Hello and welcome to this briefing hosted by Act for Public Health. My name is Manel Kappagoda and I am a senior staff attorney at the Public Health Law Center. I am delighted to be joined by Cody Venzke. Cody, do you want to introduce yourself?
Thanks, Manel, and hi, folks. It's a pleasure to be here today. I'm Cody Venzke. I use he, him pronouns. I am a senior policy counsel at the American Civil Liberties Union, where cover our policy work around data and technology. And that includes both comprehensive privacy, artificial intelligence, and governmental uses of data, both at the federal and state level.
Great. Thank you, Cody. We greatly appreciate having Cody's expertise and perspective on this webinar today. The Public Health Law Center, where I work, is a nonpartisan nonprofit affiliate of Mitchell Hamline School of Law in St. Paul, Minnesota. We provide legal technical assistance to partners working on improving public health across the country. We do not provide legal advice or lobby. Thank you all for joining us for this twice-a-month briefing series from the Act for Public Health. This series is to help explain and interpret the impact of recent federal actions on state and local public health practice. Act for Public Health is a partnership that includes my organization, the Public Health Law Center, ChangeLab Solutions, the Network for Public Health Law, the Center for Public Health Research, and Public Health Law Watch. For today's discussion, we're going to look at federal actions related to data consolidation with a focus on Executive Order 14243, stopping waste, fraud, and abuse by eliminating information silos, directing the consolidation of data across federal agencies. I'm going to refer to this executive order as the silo executive order because that is a bit of a mouthful, the full name. We're also going to give a brief overview of some lawsuits brought against the administration related to data access and data consolidation, most of which are still working their way through the court system. And finally, a quick note before we get into the substance. The Act for Public Health has created some great resources on executive orders and other actions from this administration. Leslie's going to be posting links throughout the webinar. We're also going to be posting relevant links related to this topic. All of that information is going to be available to you after the webinar along with the recording, so don't feel like you have to copy every link that goes in the chat. There's a lot to cover, so we are going to jump in. The Trump administration has stated that one of its priorities is to promote government efficiency and streamline the federal government. The stated purpose of the silo executive order is to, quote, promote interagency data sharing, eliminate bureaucratic duplication and efficiency while enhancing the government's ability to detect overpayment and fraud. So that sounds pretty good, but many agencies and organizations have raised concerns about this executive order and the administration's approach to dealing with highly sensitive data, such as protected health information. We're going to get into those concerns, but first of all, Cody, could you just give us an overview of this executive order? What's in it?
Yeah, and let's take a step back even further from that momentarily and talk a little bit about federal data and how it's organized and what it does. Federal agencies, which we all interact with day to day, whether it be the Centers for Medicare and Medicaid and Medicare Services, the Internal Revenue Service, or others, all need information to not only carry out their duties, but to provide us services. And often that information is identifiable to particular individuals, and it can often be very sensitive, whether it be health records, information records, or more. For the most part, federal policy has long focused on keeping that information in its particular silo or the agency or sub-agency where it's needed to carry out the agency's duties. Occasionally, though, that information can and should cross those silos, cross those agencies. For example, many of you may have students or recently have been students in college, and part of that experience is filling out the FAFSA, which is a federal application for federal student aid. One of the great innovations is that you can connect that application with the IRS data, where it'll automatically populate some of those onerous things like your aggregated general income and things of that nature. So it can also be used to provide services and make the government more efficient for people, which is one of the top lines that is purportedly underlining this executive order. But this executive order goes a lot further than anything that we've seen in previous administrations in terms of bringing together federal data. Its broad goal is the consolidation and sharing of data across the federal government and between state governments and the federal government. And this can be particularly concerning because, as I said, one of the ways that we help ensure that federal data is not misused, abused, or put at risk by oversharing is by keeping it in the agencies where it's really needed to carry out the agency's duties and to provide us all services. So this executive order has three broad goals. The first is a broad sharing and consolidation of federal records across the federal government. The executive order orders executive agencies to begin making preparations to consolidate federal data and share it across agencies, including with individuals who are designated by the president or agencies' heads to have access to information. This order came out in March, and obviously that seems to anticipate sharing with DOJ individuals who are seeking to cut federal programs or otherwise make changes in the federal government to trim governmental spending. But we're also seeing then the executive order take a second broad goal, which is collection of state data. The executive order directs agencies to take all necessary steps to ensure that the federal government has, quote, unfettered access, end quote, to data that's held in state programs that receive federal funding. And this can be things like SNAP, Medicaid, or K-12 public education. And then the third goal that we see is a particular emphasis on unemployment information. The executive order singles out the Department of Labor to, quote, immediately provide unfettered access of data regarding unemployment compensation claims to the designee by the president. It seems that this was geared primarily toward unemployment claims, such as the monthly unemployment numbers that we see. We haven't seen that pan out in reality, so we're still curious what that particular provision was meant to cover. But overall, this is a sweeping change in federal policy, which, as I said, is focused on ensuring data stays where it needs to be to provide us services, and it says move towards one about sharing that information.
Okay, thank you, Cody. That was a helpful kind of overview and orientation to this executive order, and the order and your explanation kind of gives us a sense of how the administration is thinking about data sharing and data consolidation, and how it's proposing significant changes to how the government collects and manages data. So since March, has anything happened related to data consolidation and data sharing that we should know?
The short answer is yes, a number of things have happened. And we've seen increased data access across the federal government, including a number of areas that touch directly on public health. For example, we've seen DOJ, as well as other agencies across the federal government, increase data access at agencies like the Social Security Administration, NIH, and CMS, the Centers for Medicaid and Medicare Services. And I'm going to briefly touch on each of those. First, regarding the Social Security Administration, we saw that in the early stages of the administration that employees from DOJ, which is the Department of Government Efficiency that was formerly led by Elon Musk, focused on using high-tech measures to identify government inefficiencies, overspending, and things of that nature, had gained access to Social Security systems. That particular access had raised significant concerns about what data might be accessed by DOJ employees who are now present at SSA. That resulted in a lawsuit under a number of federal laws that we'll touch on, I think, later, including the Privacy Act in 1974, as well as specific provisions in the Social Security Act that are meant to protect the privacy of our information. That particular lawsuit entered federal court where there was an analysis about whether or not these provisions resulted in violations of the Privacy Act and other laws. It worked initially. There was an injunction presented against the access, and it worked its way up through the court system due to appeals by the federal government. Interestingly, this reached the Supreme Court, where in sort of unusual turn of events, the Supreme Court reversed the injunction that was provided to protect our information. The Supreme Court didn't provide a detailed discussion as so whatsoever, because theoretically it was simply a procedural move. But this sort of set the standard for some of the data access we have seen since then. Perhaps most concerningly, recently, we've been seeing increased efforts around entities that are in the Department of Homeland Security that focus on immigration enforcement, look toward domestic or civil agencies as part of their immigration enforcement. The Department of Homeland Security, for example, recently entered into a data sharing agreement with the Internal Revenue Service, but specifically on public health information, Immigration and Customs Enforcement, ICE, recently was reported to have sought data from state Medicaid agencies regarding beneficiaries, driven exactly by the executive order that directed entities to seek to acquire state-level data. And initially, ICE was seeking information from a handful of states, California, Oregon, and others, purportedly to identify fraud in the system. Now, you might wonder why ICE, of all entities, was seeking this information, but the fact is that ICE was seeking information such as citizenship status, names, addresses, very little about income or other information that might be relevant to analyzing whether or not fraud was being perpetuated on the Medicaid system. This data sharing recently expanded beyond the handful of states where it was initially taking place. In early July, the Immigration and Customs Enforcement Agency entered into a data sharing agreement with CMS, the Centers for Medicaid and Medicare Services. This data sharing agreement provided broad access directly to ICE agents. ICE agents were given credentials to be able to log into a key Medicaid database that included information regarding the beneficiaries who receive Medicaid benefits. And this information, of course, might include people who are not citizens of this country. Although you generally have to be a citizen or to receive Medicaid benefits, there are exceptions. Some states have permitted the state portion of Medicaid to provide services, as well as legal permanent residents may receive Medicaid as well. So this has raised concerns that ICE is going to begin using that Medicaid information for immigration enforcement. And it really underscores the necessity of why we would want our information to remain in place. Because even if, for example, you support the administration's immigration agenda, you can see how that will have downstream effects of chilling people from accessing necessary services if there is a risk that that information might be reused. And there are other examples, for example, not necessarily geared around immigration enforcement. You may have seen that the National Institute of Health announced that they were going to build a real world data sharing platform that acquired data from Medicaid and Medicare, as well as data brokers and fitness apps. That is still under construction, but has raised significant concerns, especially among the disability rights community, where it was purportedly going to be used to build an autism registry. So data sharing has definitely become the mantra of this administration.
Okay, thanks, Cody. And I don't want to put you on the spot, but could I just ask you, can you share a little bit about what the states like California that oppose the administration's action in terms of accessing their Medicaid data, kind of what their arguments are at a very high level?
Yeah, the states where the initial Medicaid access was occurring did file a lawsuit in response. And their lawsuit raises a variety of claims. Sort of at the center is the Medicaid plans that states have to enter into to receive funding under the Social Security Act. And the Medicaid plans are required by law to include certain provisions that protect people's information. For example, the Medicaid plans have to point to areas of state law that will limit the use of Medicaid program data. And that Medicaid program data can only be used for purposes of carrying out the Medicaid program. So it has a very strong, what we call in the privacy world, purpose limitation. There are only certain purposes the information can be used for. In addition to that, the Medicaid state plans require states to set up procedures to ensure that whoever they share the information with have privacy protections that are at least as strong as the state's own privacy protections. This is the idea that there won't be some sort of loophole in the protections by passing it on to a third-party processor who then will use the information for their own purposes. So some of the arguments is that these state requirements implicitly carry over to CMS as well as other agencies, and that ICE's access of the information violates the Social Security Act's privacy protections. We're also seeing claims made under the Privacy Act of 1974, which is a general privacy law that regulates how federal agencies can use our information. It actually gives agencies a lot of flexibility. There are 13 sort of permitted use cases, including agency employees can use the information however they need to carry out their statutory duties. It also allows agencies to publish permitted uses. These permitted uses have to go into the Federal Register. The public can see them and review them. But what the state AGs are arguing is that these actions by ICE and CMS to share the data violates the Privacy Act by not fitting within any of those permitted purposes.
Great. Thank you for that. I think that's helpful for our public health audience. And I actually want to make sure that we're putting all of this information into the context of public health practice in the United States, given Act for Public Health's focus. So as Cody mentioned a little earlier, public health practice and research relies on access to identifiable health information from a wide range of sources, including patient data and community surveys for public health surveillance. And public health agencies use that information to protect the public's health and to inform public health programming. Public health professionals and the attorneys who advise public health agencies across the country are very aware that public health data must be managed carefully and protected thoughtfully because of the risks to privacy. States address these risks while assuring ready access to essential health data through laws, policies, and procedures governing data acquisition, use, and exchange. And Cody just touched on that as well. Additionally, public health agencies at all levels must comply with relevant federal laws, such as the Privacy Act and HIPAA. And so it is a complex patchwork of laws and policies with the underlying goal to promote the public's health through effective data sharing while also preserving individual and group-related privacy. Complying with this patchwork of laws and policies can be really frustrating, time-consuming, and confusing. And nobody in public health surveillance is trying to create data silos for their own sake. But the federal, state, and local laws that govern public health data sharing are in place to protect privacy, avoid unwarranted discrimination, and ensure lawful and ethical data exchanges. I'm going to have Leslie put examples of 2 states' legal frameworks for public health data sharing in the chat. One, because I think these examples show how complicated these frameworks are, but 2, because they also point at how carefully states think about these issues and how carefully public health and health agencies think about these issues. When it comes to public health data sharing, trust among jurisdictions and trust between the public and health departments is critically important. And it seems pretty clear that federal actions like this executive order may undermine the public's trust that their protected health information will remain confidential when it's being used by a government agency for public health purposes. Some states have long been concerned that sensitive protected health information such as HIV status, reproductive health information, and as you have talked about, Cody, immigration status is going to be used for immigration enforcement and criminal enforcement rather than the intent of whatever program the data has been collected for. Cody, can you just talk about the implications of this executive order on this issue of trust and the public's belief that government agencies can be relied upon to protect their private information?
Yeah, absolutely, Manel. One of the biggest reasons we implement policy protections around things like healthcare data, like financial information, is to ensure that people can trust the people that they've given that information to be good stewards. And because it's particularly sensitive, the fact that it might be disclosed and used for purposes either that the individual did not anticipate or that are actively harmful to the individual's well-being can have a chilling effect on their desire to access healthcare. And that can be particularly harmful in instances where we are counting on individual access to healthcare to have an add-on public health benefit, such as in cases of vaccines and things of that nature. But it's also worth noting then too that there are wider systematic impacts as well. Our use of our information doesn't affect just us individually, but there's a concern that this information may be combined across governmental agencies to create sort of centralized surveillance dossiers on each of us. And I don't mean surveillance here in the sense of public health surveillance where we're monitoring outbreaks and things of that nature, but instead the national security sense, where compiling of information that draws together the dots on our lives from the IRS, from CMS, from SSA, from the Department of Education, creates a sort of mosaic that's very revealing about each of us that we did not anticipate the government would have in a centralized sort of way. And again, that sort of creation of centralized dossiers may have a chilling effect for people's exercise of their rights, and it may be used in ways that are harmful to those individuals' well-being. It also creates a risk of misuse of information. If our information is pulled together in a centralized way, it means that the agencies that gathered it and used it to help us and provide benefits have given that access to other agencies who do not necessarily need it. There are particular ways that this can be technically done, but it requires a good deal of sophistication as well as sound data governance policy at the federal level. And we've seen over and over again instances of governmental employees using their access to information to either further their personal need, good and financial status, or, for example, to snoop on family or people they are in relationships with. So there's that potential risk of misuse. And then finally, there's the added harm of security breaches. When data is being shared broadly, it becomes harder to ensure that the systems where it's being stored and retained are adequately protected. And there's an increased concentration of that information, especially particularly sensitive information like health information. There's an added incentive for hackers to particularly target that system, including foreign adversaries who might hope to find information that would be valuable for counterintelligence activities in that information. So each of those risks have the compounding effect of not only chilling individual access, imposing harms to them, but as well as creating systematic harms as well.
Thanks. Thanks, Cody. And I think Leslie has put this in the chat, but I just want to highlight that Cody has written a great brief that goes into some of these issues in a little bit more detail, and there will be a link to that in the chat. So with the time that we have left, and I want to pat both of us on the back because we've been extremely disciplined and we have a good amount of time for this section, we're going to move over to just kind of recommendations for actions, policy recommendations that you may have, Cody, to address some of the challenges and concerns that we've talked about so far.
Yeah, there are several that can be undertaken in this space. One is to continue being thoughtful at the federal level about how we connect databases to ensure that we are able to use those connections to make services more beneficial and more efficient for individuals who are seeking governmental benefits without the added risk that some of the data consolidation efforts that we are seeing now might pose. And one of the ways that we have seen this is through a pilot program that was actually established during the first Trump administration and further carried out during the Biden administration to link data and link data through the National Science Foundation. This is primarily geared toward research. How can we ensure that aggregate data sets or data sets that can be aggregated are shared with the agencies who might be able to make use of them? And then this particular pilot program ensured that those data linkages had significant privacy and security safeguards. For example, ensuring that the data was anonymized to the extent it can be to benefit the research, ensuring that only the minimum data elements that are needed for the research are shared, and ensuring that the data was deleted and returned once the research project ended. And similar provisions could be made for linking governmental programs to ensure that individuals are able to receive benefits. Obviously, that's not one-to-one. You can often conduct research on aggregated or anonymized data sets. But if you want to ensure that the same individual signing up for FAFSA is the person who filed these particular tax returns, you can't do that. But there are important lessons learned from that pilot program, and the administration should turn toward expanding on that rather than replacing it with wholesale data consolidation. I also think it's an important time to be thinking about some of the laws that govern in this space. I mentioned before that one of the primary laws is the Privacy Act of 1974. It just celebrated its 50th birthday last year and was made in a time when computer systems took up entire rooms. And we've come quite a way from there in sharing health data and sharing other kinds of data, where it's much more fluid than it used to be. And many of the provisions in the Privacy Act of 1974 assume that there will be good stewards of our data at the federal government of all times, and that their decisions will be in the best interest of the public and of the individuals whose data they are stewarding. That may not be the case. And so we may want to give some thought to updating the Privacy Act of 1974. Are there particular use limitations that we want to ensure are built in to the law? Do we want to ensure that there are independent bodies that are capable of supervising federal data usage rather than just leaving it to agency heads? And then finally, it's probably an important time for us to think about the role of artificial intelligence. And this cuts across both the private sector, the state level, and the federal level. The president released yesterday the AI Action Plan. It has some impact on state regulation of AI that has raised deep concerns for the ACLU and others in the advocacy space, but also has some really promising provisions about using AI to help increase governmental benefits and people's access to governmental benefits. And that could be really, really robust. But we need to be thinking in a really concerted way about how do we want AI to be regulated in the healthcare space? What sort of information do we want to have access to, not only in making decisions about our healthcare individually, but to train those AI systems? And then how should the federal and state governments be using AI to implement federal programs? We've seen some safeguards emerge at that level. Many states have stepped up to pass regulations. The federal government has a very wonky administrative agency known as the Office of Management and Budget that has implemented guidance that would provide safeguards, including in certain healthcare scenarios. And so we've begun sketching that out. It's important that we carry through with that intention in providing regulations in a thoughtful way as AI continues to change governmental benefits and change the healthcare sector.
Thanks, Cody. I just want to underscore that your first recommendation about the pilot program is a program that the first Trump administration initiated. So that's very interesting, and also appreciate your comments about AI, because I know that is a topic that public health and all of us are wrestling with. So thank you for raising that. I am going to add a few more recommendations quickly in the limited time that we have left. State and local agencies should make sure that their data governance practices and policies are well documented and understood by staff across the agency that they work in. Staff should not share data just because they don't know if they have a right to refuse the request. And they should consult with legal counsel to understand state and federal legal obligations as they relate to data access and use. Leslie's going to put an example of a clear state data plan in the chat. That's a plan from Connecticut, as well as an article about the New Mexico Healthcare Authority's response to the USDA request for SNAP data. And I also want to just lift up that our partners at the Network for Public Health Law recently issued a blog post about litigation over SNAP data that included some excellent recommendations for jurisdictions as well. Great. So we have 1 minute left. With that, I'm just going to end by saying it's really important to understand that courts matter. We said this on a previous Act for Public Health webinar, but it bears repeating. Courts provide challenges and opportunities, but the viability of public health depends on the courts, and the composition of the bench matters. So public health community, please pay attention to that and get involved. I'm going to wrap up by thanking Cody so much for sharing his brilliance and expertise with us. We really appreciated your great contributions today. This is the final briefing in this Act for Public Health series. There may be another series in the fall, so look out for that. And please feel free to send us suggestions or feedback through the Act for Public Health website. A survey is going to pop up at the end. Thank you, everybody, and thank you, Cody.
Thank you. Pleasure to be here. Thank you for joining us, folks.